second trimester, okay? And then you have rapid cell production and you have pruning or apoptosis. So all cells will proliferate, will migrate, and then they start to have more myelinization, okay? So the migration stage is where some problem, I mean, you can have problems at any stage, but like I said, you will come across a lot related to migrational problems. So now we talk about the environment. So when we say environment that influences development, so what ideas do you have about environment? What in the environment can influence you? So diet, okay. So what you eat. Okay. That's but let's look more at like raw environment, not sort of the inter kind of personal things in your environment. So things like diet, a mom that's pregnant, what could affect the health of the baby? Yeah. So medications that she could be taking, stress, smoke, weather. So her illness, her general health, infections. So when you said weather, I'm thinking viral infections, flu, things like that. All right. So these are really essential in terms of how they affect the growth of the baby, right? So you have a lot of these teratogens, so prescription medication. So in obstetrics or gynecology, so there are subspecialties that deal with fetal maternal sort of health or wellness. And in psychiatry, we have women mental health. Okay, so in women mental health, we see pregnant women who have mental health issues. And a lot of it is to do with, making sure that the medications that they're taking are not going to affect the health of the baby, right? So these are like known medications known to cause very specific congenital anomalies, right? And then when we look at substances of use, because someone said smoke, so smoke, drugs, okay? So we have fetal alcohol syndrome that's related to alcohol. As well as like when we said smoking, so sometimes smokers will have spontaneous abortion. Then diseases that affect the mom, so if she contracts rubella or herpes or varicella, so again causes very specific issues in the baby. Then when we look at radiation, so that's kind of all over the place. Obviously, when you go to get an X-ray, a CT scan or something, and if you are, pregnant, they always put that lead thing on you, right? Even if you are not, they will always put lead protection on your thyroid, on your like central part of your body, just to prevent any kind of radiation affecting vital cells. Okay. So fetal movements. Has anyone here, like, when your mom was pregnant with your siblings, ever felt babies move or, yeah. So movements are, it's like they move from the very beginning, but however, we only feel them later on. And why is that? Why don't we feel them from the very beginning? Why does it take time for us to feel fetal movements? Yeah, because they're swimming in a bag of water, okay? So we start to feel them at 18 weeks, because by then they're like big enough to actually be felt, okay? But they're actually detected by ultrasound earlier on, okay? You have fetal breathing movements at 10 weeks. So this is where I'm saying these numbers matter, okay? So these are numbers you need to pay attention to. Arm and leg twitches at 10 weeks, hand and face contact. So like, baby puts their hand to their face at 10 weeks. They stretch, they rotate, they yawn. So they do everything that we do, because they are us, but like tiny, okay? They will suck their thumb, they will swallow amniotic fluid, okay? And there will be eye movements, but are their eyes open? No. So the eyelid is not open, okay? But you can see obviously some eye movements. So the fetus is active in utero throughout, okay, pregnancy, because again, it's a mini person, okay? So we are active, but we have times when we're not active. And when is that? When are we not active? When you're sleeping, okay? So babies, fetuses will sleep also. And why is it that they need to rest? What would happen if they're like moving all the time? What happens if we don't sleep? We're going to be exhausted. Okay, so we all need to have active time, like chill time, sleep time. So the same thing happens with fetuses. Okay, so they've observed like 4 states. Okay, and pretty much from 36 weeks gestation where they can actually measure based on heart rate, eye movement, and body movements. And so they've divided fetal movements into kind of 4 groups, if you will. So they said there's quiet sleep, there is active sleep, there's quiet awake, and there's active awake. And each one of those has certain characteristics. So in quiet sleep, so there's occasional startles. Do you know what a startle is? What is a startle? Yeah, so like that, you know. So occasionally they're like occasionally there are no eye movements. Heart rate is very stable. Okay, and this type of activity occurs 15% at 36 weeks, and it increases towards term. So towards term, like term is in like 38 weeks. Towards then, you have more of this state. Okay, then you have active sleep where there's more active body movements. There, you have eye movements. Heart rate has some accelerations, and it's actually the most common state. Okay, so this is the most common state. When you have quiet awake, where there's no gross body movements, there are some eye movements, there's no acceleration of heart rate, and it's very brief, occurs briefly. Then you have active awake, all right? So this is where they're just up and like moving, so they're continuously active. There are eye movements. Heart rate is unstable, so you have more tachycardia. Okay, and it occurs at a less percentage because obviously it's like a state of like where it's too much of the state will like exhaust the fetus. So this would be the least common. So what about senses? Do fetuses have senses, like 5 senses or 6, you say? Can we detect fetal senses? Okay, so what senses are there? What are the senses? Yeah, you're pointing. So vision, smell, taste, hearing, and touch. Okay. So they do respond to sound from around 22 to 24 weeks. So how do they know that fetuses are responsive? How do they know that they're responsive at all? It's by movement and heart rate. So if you have a stimulus and the fetus moves or there's an acceleration, then you know that there's a response. Okay. So they respond to sound from 22 to 24 weeks. Okay. And they begin hearing at a lower frequency of the adult hearing range. So they hear at a lower frequency. And the reason is, I mean, they live in a very noisy environment. Okay. There has to be like a dubbing system where imagine if you're sitting in like a workshop with noise, and so that's a lot. So that's why again it's the frequency of hearing is not the same. Some moms actually talk to their babies. I don't know if you've ever seen or heard of that. Why do they do that? Okay, so that's really like the beginning of bonding. You know, some moms, they start to talk to, sing to, and they say that, I mean, it's the beginning of the recognition of her sound. Okay, some people read, like in the old days where there were encyclopedias, they'll read encyclopedias to their kids or read all sorts of reading material. You're like, no, you agree or disagree? I mean, it's not going to make the child smarter, obviously, because you're not going to acquire, or else like it'd be nice if we're all asleep and someone reads the entire like medical whatever on top of our head. But I think it's just the beginning of attachment. Because a lot of times moms with first babies, I mean, one of the main complaints that, they present to me, they're like, I don't know how to deal with, I don't know how should I talk to my baby because it doesn't really understand. So the thing is, it's not about the need for the baby to understand you. It's about the connection. That when you talk to the baby, and we'll learn more about that in the next lectures, when you talk to the baby and when your face moves and you're smiling, that's really the beginning of a connection. Like if someone talks to you in a language that you don't understand, like I don't know, someone talks to you in Brazilian, I don't know if anybody here speaks Brazilian, but like if somebody talks to you in another language, you can connect just by the way that their eyes are moving and they're smiling. So you can have a connection. They don't really need to understand what the person's saying to actually connect to them, but you can hear their sound, you can see their face. Okay, so it's really important for the face to kind of be, if you can't really see someone's face, you don't really connect to them. So yesterday out in the clinic with that 6-year-old girl, she was really curious to see my face, because I was wearing my mask obviously in the clinic, and she's like, I could feel her kind of wanting to go from inside and wanting to see my face. And then she tells her mom, like, I like her eyes, I just want to see her face. She's like whispering. So again, when I remove my mask, you just, the connection. Okay, so it's really, especially for mental health, like for psychiatry for sure, you need to see the person's face. Okay, so they hear. Okay, it's hard to sort of detect the smell and the taste. Okay, particularly smell, because they're in this bag of water, but they're able to differentiate between sweet and noxious is like bitter. Okay, and what they did was, like if they inject through like they put a needle and they'll inject something that is sweet, they found that the baby would probably move towards it, versus if it was noxious, that they would like move away from. Okay. Also, they said like newborns prefer mom's odor. Now in certain like countries or whatnot, the baby is born and they like put them immediately to the mom. It's like skin to skin. And that's really for the bonding, for the sense as well as the smell. So the smell is really important for babies. Like they connect at that level. They know their mom's smell, they know their mom's feel. And we'll talk about that more in lectures to follow. So neural pain pathways are formed at 26 weeks. And again, behavioral reactions to painful stimuli. Obviously, it's not something people want to do, is like go in there and poke babies, but I mean, that's how they figure out, like in research, that they are responsive. So if you do poke it, it's obviously going to move away. It's not going to sit there waiting for you to like hurt it. Mothers feel more fetal movements when they're like in some, if they're taking a warm bath. So it seems like it warms up and then they start to kind of move. So they do kind of respond to temperature. Okay. The first sense to develop is touch, and that's from like 8 weeks. And they're saying that generally they will move away from stimulus early on, and then maybe as they get older, the responsiveness to touch is not it's not like they're going to be specifically moving away from a stimulus. They may kind of maybe move towards, again, depending on the type of stimulus that there is. But again, keep in mind, like when you go in there and it's an amnion, it's a needle, right? So not a lot is done to kind of try to poke babies. And then why is vision the least likely to be stimulated? Yeah, because their eyes are closed. So their eyes are closed. So it's really hard to tell, their responsiveness to light. But obviously, one of the first things that they do check when babies are born is their visual response to light. You can't really test visual acuity. You know what visual acuity is? It's like when they can actually see. So you can't really test that at birth. It takes a few months for kids to start to be able to focus, but at least they check their reaction to light. So are they able to learn? Do you think we are able to learn from in utero? Or do we have to be born and go to school and then start learning? So learning is a really interesting thing, because again, you learn all the time, okay? Even from in utero, you are still able to develop basic learning concepts. So they talk about something called habituation, okay? So when you are exposed to a stimulus for the first time, your reaction would be exaggerated, but then the repeated exposure to the same stimulus, your response gets less over time. And what that indicates is that you've learned. Okay, you've learned something about that stimulus. So like, let's say you every day you come to uni, and then there's like this barking sound that you've heard for the first time. It startles you, but every day you hear that barking sound. Okay, you know, okay, there's a dog. Okay, there's a dog at uni, and then eventually you probably won't even hear the sound because you've already become so used to that stimulus. You've learned it. Okay, then if they change the place of the dog and they put the dog somewhere else, then you may be startled again because you were used to hearing it from this side. Now you're hearing from that side. So what it means is that we learn all the time without even being aware that we're learning. Okay, so that's called habituation. So they say that they become habituated to auditory stimuli from 22 to 24 weeks. So sound would cause more of a response early on because it's new, and then eventually there's less response, not because they're not responsive, but because they're used to it, unless you present a new sound. Okay, and they're saying that females are probably quicker at habituating or kind of figuring things out more than males. Again, it could be just all right. And then exposure learning. So when we said that moms talk to their babies and then they become kind of familiar. So what they found is that after delivery, when mom talks, they found that, some babies, their heart actually accelerates. There's acceleration because they recognize. So it's a kind of an excitement because they're kind of excited that it's a familiar sound that they've heard. They said something about music preference at 36 weeks. So when you play music, the baby kind of moves inside. So if any moms are like really into like music, and so you can kind of connect to your baby. Okay, so moving on to like functions of behavior. So it's important like all these senses are up to par, because actually after delivery, that's really when babies are gonna use all of that. It's going to come in handy because now they have to face life. Okay, so recognizing the mom, so like kind of figuring out that was her sound, that was her voice, and then actually like meeting her in person, that would be exciting. And then it prepares them for as well the attachment, because the first experience they have is the breastfeeding experience. So that's really the first human contact that they're going to have, and then there's so much to be said about that experience, like when we talk later on about Freud, and so much to be said about that. It's a lot of exciting stuff. Okay, but generally all of that prepares these babies for the day they are born. Okay, now this is really important. Okay, this is like you kind of memorize it by heart. Okay, so motor development, because I don't know if you'll ever get it again until you get into peds. So motor milestones, okay? So you memorize, okay? So from 1 to 2 months, babies can start to lift their head from their so they're like flat. They can start to like lift their head a bit. At 3 months, they can control their head in sitting position. You know those bubble toys? So when they're like, so usually at 3-month-old, when you sit them up, their head is like a bubble thing, right? It kind of moves. Not yet very stable, but there's no head lag. Okay, importance of this is like we see kids with developmental delay. So when you have a 3-month-old and you pull them up and their head lags, that's not normal. Okay, so that's an indicator, and maybe there's some motor problem with this child. Okay, 3 to 4 months they start to roll over. Why is this a really important milestone? Super important. Super important. They start to roll over because this is when accidents happen, right? So this is when mom's, the baby's there, and then she hears a blop sound and the baby's on the floor. Okay, so we tell moms, when they go to the prenatal clinic, like for follow-up, be careful. That's when they start, especially if it's a new mom, doesn't really know much. Like moms who've had more than one kid are like, oh yeah, he just fell. It's okay. They're kind of used to it. But it's just important. That's when accidents start to happen, is when these movements that were never there before. So 3 to 4 months, they start to roll over. That means you have to make sure that they're not at the edge of the bed, or, where they can have an accident. Again, 3 to 4 months, start to reach for objects. Why is that important? Yeah, why? Why safety? Because what do babies love to do? Everything is going to go into their mouth. Anything you can imagine, everything you can imagine ends up in that mouth. Okay. So at that age, 3 to 4, parents start to like proof screen the house, little tiny things, just make sure they're not around because you don't want them ending up in your baby's GI system. Okay. At 5 months, there should be no head lag at all. So 3 months, they're still kind of wobbly, but at 5 months, absolutely no head lag. Okay. 6 months, they start to transfer objects from hand to hand, and that's actually really cute to see. Like you give them something, they take it from here to here and here to here, spend the whole day moving from here to here. Okay. 6 to 8 months, they can sit independently. Okay. Start to crawl at 8 to 9 months. Again, this is another time where things can be dangerous because, if you're living with a flight of stairs, that's when they're going to just decide to kind of, test the stairs. And so parents put all these, doors and whatnot. Okay. 9 to 10 months, they start to pull to standing position. We've seen kids pull TVs topple over, right? The TV is now on top of the child because they are now trying to stand and then they pull and then, so again, accidents can happen. 11 to 12 months, they use the pincer grasp. Do you know what that means? So before they'll like carry things like that, but now they can do that. So when they can do that, they can pick up really teeny tiny things and put them immediately in their mouth. So teeny tiny things are going to end up in their system. Okay. 12 to 15 months is when they start to actually take independent steps. So we say kids will walk at the age of 1, so 12 months plus minus 2. So from 10 months, they can walk to 14 months. And generally, we see that boys are more able, like we see boys tend to walk quicker than girls. Girls tend to talk earlier than boys. Okay. So if you have a child that's 3 years old who just started to walk, that's definitely a child who's delayed because now we know that it's 12 months plus minus 2. Okay, so we're going to memorize these. Okay. So again, it's a very exciting time for parents, very much so for kids, because imagine like this child for the past 10 months of their life, they're still not walking. So they're like observing all the things they want to do when they start to walk, all the places they want to climb when they can now finally do it. Okay. So it's just like as if you've been starving them and then you just let them go. So you have to be very careful. All right, so eye head control is really important as a concept. Okay, so what it means is, when your head is like that and your eyes are facing forward, and then when you move your head and then your eyes move with your head. Okay, so obviously initially it's a bit slow and then it picks up. So when you're doing an eye exam for, let's say, a 6-month-old, and you kind of move your finger like that, it's the baby's not really going to follow you because that's way too quick for them. Okay. Versus if it's somebody who's older and you kind of do that, then it's a lot easier for them to follow. And it's all about just the muscle development. Okay. So infants have difficulty focusing visual attention and objects of interest. So initially it's hard, but it's achieved by 3 months. So by 3 months, they're able to have better focus. Okay. And then something called smooth pursuit, which is they can move at the same speed of the object. So when you start to move, they can then start to follow you. So by 3 months, it starts to be better, but obviously not at birth. Okay. So that's something that starts to improve with time. So you have spontaneous motility at 6 weeks. So what is spontaneous motility? What does that mean? Spontaneous motility. It's actually even just the movement. Yeah, I mean, babies move all the time. Like when they're in their crib, they're always like moving, and so it's just all the time. Then you have behaviors like thumb sucking, moving their arms, which already starts in utero. Okay. And then they start to be able to like reach out for objects. So again, the developmental milestones of when they start to move. So now you know what is normal. So you can pick out what is not normal. Okay. So locomotion, again, it's moving, it's movement. Okay. obviously depends on experience. So some parents are super protective, okay? They won't allow their kids to like do things because they're worried and know they're gonna fall, they're gonna get hurt. Versus you have parents who are like, whatever, you know, he can climb whatever he wants. Versus you have parents who are like in between. So you kind of want the in between. You don't want to be super protective. You don't want to be like neglectful. Like your child is climbing up, you know, the cupboard and it's gonna fall, and you're sitting there having your coffee. That's not okay, because you know that child could be injured. At the same time, if your child's like, you know, walking in the hallway, you don't want to be like padding hallways for your child unless they have a developmental problem and they're really prone to falling, or they're epileptic and you're worried that they're going to have a seizure and, you know, fall and hit their head. Okay. 7 to 13 months, babies start to pull, like we said, and then there's something called cruising. So you cruise in a car. What does that mean? When you're cruising in your car, you're like going, yeah. So that's what they do too. They cruise between chairs. They cruise. They kind of, again. So it's a very exciting time for them, but also it's a time that you worry about, you know, things happening or accidents. Okay. And then we said about the onset of walking. That's so Star Wars. I love Star Wars. Okay. When they start to walk, again, they start to learn a lot about their environment. So when we'll talk about the cognitive skills of children, the emotional and the social, a lot of it is, you know, happening at the same time. So development happens in parallel. You don't finish motor development to then start emotional development to then finish. And so everything happens at the same time, okay? So when you have somebody who's got a delay, you cannot assume that the delay is going to be in everything. It could be in certain areas, it could be in everything, it could be in one area. So that's why, you know, knowing when things happen helps you figure out, you know, where did it stop and how can I help this person to kind of, you know, move forward. So today is a very short lecture. I thought I'd start off with something, you know, simple, because it gets more intense as we go along. So I didn't want to have a first encounter where you guys are like freaking out. Okay. If there are any questions about anything that we said, I thought today was pretty basic and simple. Like I said, I'm going to be uploading lectures and PDFs as we go along. And so I'm not going to see you guys again, I guess, until how often, but this is kind of interesting.
7 weeks.
Oh my goodness.
So you're going to see us again on the 8th.
Wow, that's really weird. Now, I don't know, again, if there's... So, let me just check if there are any questions. Here. Okay, so somebody said, do we need to remember the percentage mentioned in the slide about the sleep? So yes, we do. So 3 slides that you don't really need to know, like I'm not going to ask you about, are the development, like the germinal period, the embryonic, so those 3 slides, because it's embryology or what you've done before. But otherwise, anything with a percentage or a number, yes, you do need to know it. Okay. So somebody again said, main source of study material, PowerPoints. So PowerPoints are the basic, that you have to know the PowerPoint. And like I said, I will ask you to go to specifically a PDF or a table or something. So I will let you know. Okay. Someone says, why is the head larger? So I said, like, it's just the number of cells to begin with are large, and then there's pruning, because some cells are not going to be like, it's kind of, I don't know if you know pruning or apoptosis. So there's cell death. So you can have like 20 million, and then are they all useful? No, they are not. So they're kind of pruned, because if you had that same number of cells, you know, can you imagine like walking around with such a huge head? So cell death is essential in all organ development. And to date, I mean, even in the brain, there are parts of the brain that we don't know what is their function. They're called silent areas. We don't know what they do. So there are parts that we don't even know how they function or what they do.
Someone is asking some general advice on how to study the lecture.
So the general advice is to study the lectures. How to study them? So I mean, like I said, numbers you need to memorize. Try to understand like timelines, and as we go along, it's really not that hard to understand. But what I'm saying is, if you don't study week by week, you will have a hard time because everything will look the same to you towards the exam. It will all look the same. Okay, what I've also advised people to do is to draw, like, so when we look at emotional or social development, try to draw a timeline, because you'll see that there's interception between cognition, social, emotional, and motor. So draw it on a timeline. Tables are really good. So that would help. And again, like PDFs only if I ask you to. If you have interest, then great, but otherwise you don't really need to. Also, I may have things come in your exam that are not in your PowerPoint, but it's something I said. Okay, so I may say something, it may not be in your PowerPoint, may not be in your PDF, but it's something that I want to deliver, and that may come in your exam. So that the reason I do that is because I want to make sure people are paying attention. Okay, so it's just, you know, we can do that. We can, you know, put a question that was not in your PowerPoint, but it would have been something definitely that we've discussed in class. Okay. So the weightage of the midterm and final, and I will let you know about that next week. Okay. So I have the final sort of breakdown. So I'll let you know next week. Okay. The project, again, it's something that's going to happen second term, towards the end of, not the beginning, because you want to finish most of the material, or I'll ask you to write like an essay of I don't know how many words, and I'll give you options to choose from, like 4 topics. You choose one of, and you do a written essay. Obviously, you submit it as in soft copies. But again, I'm going to give you very clear instructions, so I don't want you to worry about that now. Okay. Okay. Yeah, the syllabus is not on Moodle yet, so we're going to have that up for you guys next week. So you have a good outline of all the lectures, and so that one should be up next week. Okay. The midterm, I believe I was told, was March 17th. It's a Tuesday. I don't. Did you guys get a date? Okay. Again, I don't quote me on it. People there, don't quote me on it. I'm gonna find out today. Actually, they're gonna finalize. I think you'll get your schedules, but I believe it's around that March 17 time. But you guys are gonna be notified. They usually notify them. Yeah, you will be notified. And the final, I think, is end of May, something like that. When do you guys finish? Yeah, so I think mine is on the 30th of May, if I'm not mistaken, around that. Okay. All right. Thank you, guys. Thank you.